Hold, relax, antagonist contract, aka HRAC, ankle to hip mobility. The ankle is the first joint that stabilizes our body through the ground. Poor ankle joint mobility can affect the knee, hip, lumbar, and indirectly all the way up to the shoulder girdle. There are studies that show direct relationships between poor ankle mobility and poor squat technique, stair ascending and descending, walking gait, and many other movements that require the ankle to be the primary contact with the ground. The exercise mobilizes and stabilizes the ankle into dorsiflexion and mobilizes hip flexion while strengthening muscles and stabilizing the pelvis. This technique is called self-neuromuscular facilitated stretching. Typically, this technique is administered by a clinician. I developed a way for my clients to practice this on their own, increasing the frequency of mobilizing the joint each week. Let's set up for stability. Start on one knee and one foot with knees bent at 90 degrees. Place your foot and knee wider than hip width apart. Start by driving the front knee over the little toes as far as possible without lifting your heel or moving your foot. Once we reach the limit, we drive our forefoot into the ground. This is similar to pressing a gas pedal. We will press and hold for 6 seconds. 6, 5, 4, 3, 2, 1. Then we will shift our femur or our thigh bone back through our sits bone, the bone that is at the bottom of our pelvis. While we shift, we must maintain a neutral pelvis. It is essential not to collapse or flex the lower back or tilt the pelvis in the opposite direction. We will now dorsiflex the ankle, lifting our forefoot off the ground. We're going to drive our heel into the floor for 6 seconds using our hamstrings and our glutes. 6, 5, 4, 3, 2, 1. We will do a total of 3 cycles. Cycle 2, let's drive the knee forward over the little toes and go to the limit without lifting the heel or moving the foot. Use our lower leg to drive the forefoot into the ground for 6, 5, 4, 3, 2, 1. Shift the leg back through the glutes. Use our hamstrings and glutes to drive our heel into the floor for 6, 5, 4, 3, 2, 1. Once more, drive the knee forward to the limit. You may notice you are able to move the knee forward more with each cycle. Let's drive through the forefoot for 6, 5, 4, 3, 2, 1. Shift the leg back to maintain the neutral pelvis. Lift the forefoot and drive through the heel for 6, 5, 4, 3, 2, 1. Excellent. Let's go to the other leg. We're going to make sure the foot and the knee are wider than hip width. Our knees are roughly 90-degree bend. Let's shift that knee forward over the little toes. Make sure our heel stays on the ground or close to the ground. Let's drive through the forefoot for 6, 5, 4, 3, 2, 1. Shift the leg back. Maintain that neutral pelvis. Lift the forefoot. Drive through the heel. 6, 5, 4, 3, 2, 1. Again, we're going to let the knee go forward, pushing to the limit. Let's drive through the forefoot. 6, 5, 4, 3, 2, 1. Let's shift the leg back. Maintain that neutral pelvis. Lift the forefoot. Drive with our hamstrings and glutes. 6, 5, 4, 3, 2, 1. Last cycle. Drive the knee forward. Drive through the forefoot. 6, 5, 4, 3, 2, 1. Let's shift that leg back. Drive through the heel. 6, 5, 4, 3, 2, 1. Excellent work. Because this exercise activates and inhibits the muscles of the ankle, it can be done after proper warm-up, prior to resistance training. It is an excellent way to prepare the ankle for leg work, but I recommend you always do some body weight warm-up sets to ensure no muscles are inhibited before moving additional loads. The exercise is also effective post-workout, and sometimes it has been shown that doing mobilization after a workout has a better effect.